If everyone can remain on mute while the presentation is going on, that would be helpful so there isn't any interruptions. Video is optional, but if you do want to turn on your camera when you do ask a question at the end, feel free. There's one button I'd like you all to avoid hitting. It's at the bottom of your screen. It's a rectangle with an up arrow. It's your share screen button. Please do not click that, as that will interrupt the presentation. When you have questions, please either raise your hand using the raise hand feature or put the question into the chat, and I will prompt our presenters. If you have any technical issues, please put those in the chat and I'll do my best to help you through those. Just be aware that most of the time the issues stem from your own Wi-Fi connections. Finally, if anyone is dialed in via telephone today, send me an email at mfrey@pjhq.com so we can get you your PDR credits. So I'd like to welcome our presenters. Fitgolf has been one of our longtime section partners, and we're thrilled to have them back again this year. I'm sure a lot of you, if not all of you, know Nick Iacono. Nick began his instructional career at Odessa National Golf Club in Middletown, Delaware, and since then he has worked at facilities such as the Polo Club of Boca Raton, Ardsley Country Club, and Chester Valley Golf Club. He now resides in Malvern, where he is the lead golf instructor at Marion Golf Club. And Jason is the owner and general manager of Fitgolf Performance Centers in Conshohocken. He has been training golfers for over 12 years, focusing on helping golfers improve their movement, reduce pain, and play their best golf. He's one of the region's experts in bridging the gap between fitness and swing mechanics to help golfers move better and play better. With that, turn it over to our presenters. Thanks, gentlemen.
Thanks, Matt, and thanks for everybody for joining. So today what we're going to talk about is, in your setting, in a lesson setting, how to identify physical limitations or poor movement patterns to help make technical fixes in the golf swing. So the reason why Nick is here today is I've been training Nick since about a year and a half now. Mm-hmm. Yeah, probably since about November of 23. Initially contacted me just to help out with his own game. He was coming off an injury, so we've done a lot of training to get him back to track there. But what we've noticed is throughout our time working together with our mutual students or mutual clients is our ability to communicate Nick in the sense of what's going on and what needs to be fixed technically from a swing perspective, giving me tips on what to look at physically, and vice versa, me telling Nick, hey, this golfer can't rotate into his or her right hip, they have a lack of balance, whatever it may be. And we find that collaboration, that teamwork, so to speak, is super effective in getting our students and clients outcomes. So the purpose of today is just to real quick give you guys some tools within a lesson if you face some type of swing issue, to do a really quick and easy physical screen or screens. And at the end, we're going to cover just a couple of what we call corrective exercises that you could do anywhere with anyone on the spot to get them moving a little bit better, to get them a little bit looser, a little bit more stable. So when you go to work on that swing issue or swing fall, they're physically more prepared to do it.
So yeah, I've been using TPI for a long time now. I just came over from California, TPI level 3, and every time I have a student in front of me, I'm trying to understand who they are and how they move, and also where their intention lies. So typically, you kind of have like 3 types of golfers. You have your obvious golfer. What's obviously wrong with them? Because sometimes you can look at it for a minute, you're like, oh, I got that, know exactly what they're doing. And you have the complex. They have a unusual movement pattern, we'll call it a Jim Furyk. It's a complex movement, but works out really good. And then you have chaotic movements where there's a lot going on, but having the ability to do physical screens and assessments can get a better idea of, hey, why they're doing it. And from there, if we need to improve how they move physically, we can do that as well. And usually when I'm in the lesson tee, I'm thinking, all right, well, is this person intentionally trying to do it? As I would say in my dojo, intention's 9/10 of the law. Are you purposely trying to do something? Is your body inhibiting you from doing something, and that motor pattern is not exactly what you want? but we're trying to avoid some certain movement because you're just not physically able to do so. So that's why I love blending in physical screens. And a lot of the times I have my students sign up for a full physical screen. Doesn't take too long. Jason does a little bit more in-depth screen than I do. I do my 14-point screen. He uses the famous goniometer to help kind of measure and quantify certain things. But then from there, I can get an idea of, well, is this person able to actually do it? Or do they need just better coaching and a little bit of kind of a roadmap to how they should be doing it?
Yeah, exactly. So today what we're going to do is we're going to cover 3 common swing characteristics or faults that, with the help of Nick, he helped identify as to probably things that you guys face in many lessons throughout a season. So we'll go through those. There's 3 of them. Nick will talk about the swing fault characteristic. I'm going to show you guys some screens, some quick testings that you can do to diagnose on the spot, whether or not it's a technical issue, a mechanical issue, or if it's a physical issue. So we'll go through those 3, and at the end, we'll show you a couple quick, easy exercises to help your student get better there physically to make you or help you get better outcomes within a lesson itself. All right. So Nick, you want to introduce the 3? Well, first,
so the first one really is, and this might cover a broad scheme, but I wanted to kind of just hone in on just 3 ones that we talk about really every day. The first one's going to be just improper bends and tilts of your body. The second one's going to be kinetics, forces and pressure and torques, all those kind of things, how you allocate those or how you use them. And then the last one's really going to be the kinematics, because those are words that we hear a lot. Those are things that students do every day. It's just a matter if they do them in a really good way or really bad way. So improper tilts is really a big one. So in golf, you should be tilting and bending your body. Okay, so I'm just going to back up a little bit. So, in the golf swing for a righty golfer, as you're turning to the right, you're bending to the left. Some bends and side bends are kind of getting interchanged, and we have to make sure that they're doing it not only the correct amount, but also the change in those movements are really good. So someone could say move into, say, left side bend, but if they're doing too much at a given time, that could be a problem. Now, for me, what I'm trying to do is, okay, understand, is this golfer doing it because they have to? Because your body has mobile and stable joints, right? So I have to figure out where is kind of like the body fault and everything. And if that body fault is there, then if that segment cannot load in the backswing, then other pieces are going to take on that load. So example, let's just say, turning into your right side. So we'll talk about how your pelvis, your right hip gets higher and your left hip gets lower. Lefty, it's going to be opposite in the backswing. So let's just say a golfer has really poor internal hip rotation. So they're turning right into that right hip. Now, I actually had this problem to start, and a main reason why is just because I had poor hip mobility. I couldn't actually turn into that hip. So there are workarounds to kind of deal with that a lot of times. So I'll try to add in some workarounds if I can. Flaring the right foot out is really good. Now, just understand when you increase mobility on one side, you're probably going to decrease it on the other end. So you got to be a little careful on how much you do. As I would tell my students, 2 Tylenol, not the whole bottle. Okay. So I couldn't load this hip really well. Now, my game is very hot and cold. I can shoot anywhere from like a 79 to like a 68, but it's depending on the timing of that round and how I feel, obviously, too. So I couldn't turn it to the hip, so I would lose a lot of my posture. So for me, I was trying to left side bend, but I actually physically couldn't do it because of how my right hip was designed. And through working with Jason, talking with him and with people that helped me my golf swing, I realized that it really wasn't a intention problem. It was like I actually couldn't do it. So through Jason doing some screens and working together, we started, okay, well, we got to get the mobility in this hip, and then we'll build stability and strength from there. Yeah. So I'll let you kind of take from there.
Exactly. It was one of the first things we had talked about when they came in, and you were having some right hip discomfort too.
Yeah, and that was one of the injuries that I had during the year last year. It was actually during the Burlington Classic. I had a rib injury, and kind of subsequently I had a hip discomfort or pain from there. And, I was, fourth group, third group, kind of going, finishing the round there. So I was kind of right near the leaderboard, and I had to back out because I'm trying to load and I couldn't. So something else had to pick up the slack, and then I ended up getting hurt.
Yeah. Exactly. So you're going to see this issue with a lot of your golfers loading the right hip, just giving good rotation to the right in general while maintaining tilts and bends, right? So you see a lot of reverse spine angle, maybe some sway, some extension. So I'm going to give you guys 3 quick screens to test for this. If you see these types of issues in the swing, loss of posture, incorrect bends. The first one is called the lower quarter rotation test, and it's really simple. So you need a 6-iron and an alignment stick. And this is one of the first things I wanted to see with Nick. So what we'll do here in terms of putting this on the ground is you want to have the alignment stick flush with the lie angle of the club. This is giving us a 60-degree angle, right? So we'll set this down on the ground.
Unless you're 3 flat like me.
And here you go. Now, when you have your golfer set up for this, you want them facing the shorter angle. So we got a short angle, that's 60 degree, and then a much bigger angle here. So Nick, what I'm going to have you do is you're going to set your right foot perpendicular with the club. So we're looking at trail hip rotation here. Get your left foot real close to your right. Then we're going to have the opposite heel off the ground. Now from here, what I'm looking at is can Nick, rotate his pelvis to the right 60 degrees. So what I'm going to have him do is he's going to turn 3 times to the right. Yep, pretty good. And bring it back. Let's just do one more. This is something that we worked a lot on. What I'm looking for, hip bone, hip bone. Are we more than 60 degrees? If we are, you pass the test. If not, you fail the test, right? Now, we would do some lead hip external rotation for the backswing as well. So left foot down, okay, right foot a little bit closer. And we're just going to do another turn to the right. So I can see in his backswing to the right, he's got more than 60 degrees through the right hip and the left hip, telling me that if we had an issue with maintaining posture, maintaining tilts and bends in the backswing, it's not because of his right hip, right? Now, that's something that he's worked on a lot. That was not the case in the beginning, but I think you'd agree once we cleared that up with various interventions, the hip started feeling better and you felt.
Yeah. And I have had, knock on wood, no pain since. And that was a huge deal in being able to do what I want to do. Because then from there, I couldn't load into the right side. I wasn't activating, say, glute muscles, quad, all these things. And then there was a huge disconnect. So I'm trying to figure out how to get back and recenter. And I just couldn't do it because my right hip was really causing those issues.
Yeah, exactly. Now, if we want to test the lead side too, so you stick that 6-iron, change the angle, right? And do the same thing on the left. Let's just do left hip, lead hip, internal rotation to get a look. This was never really an issue with Nick, but you will see with a lot of your golfers, the inability of the lower quarter to rotate to the left, which then of course is going to affect impact positioning, the ability to rotate the pelvis through the ball, maintain posture. So if you have a lot of golfers with early extension, slide, loss of tilts, loss of bends in the downswing, that's a test on the left side that you'd really want to look at to see if there's a hip, knee, or ankle mobility issue, right? So that's the lower quarter rotation test. Okay. Now, the next one that we want to look at is the thoracic spine, the trunk. So this one's very simple to set up too. Let me pull this forward here. All you need is a chair, right? And here what we're looking at is how well a golfer can turn their upper body or their trunk. So in terms of an easy way to measure, just take 2 golf clubs, right? Get a 90-degree angle, right? We're going to place it down. So actually we're getting 2 45-degree angles down on the ground. Now I'm going to have Nick take a seat on the stool, okay? Now, what we want to do is we're going to take a golf club or an alignment stick and place it behind the shoulders. Now, a lot of your students, especially the older golfers, are going to have a really tough time getting that club or stick behind their back, which is why we like an alignment stick. It's got some give, right? So I would suggest using that for setup. You can take that. And then what I'm going to have Nick do, and what you have your golfers do, is you're going to have feet together. Nick, take your right foot, hook it across your left, right? So the left foot stayed down, right foot's over, which means we're turning to the left. Now, with the golfer's legs together, I'm going to have them turn their trunk as far to the left as you can. So go ahead and do that, Nick. When I'm looking at, and bring it back, do that 3 times, is does the alignment stick or the golf club, all right, surpass the 45-degree angle on the ground? Now his does. All right, that's great. So he's got good trunk rotation to the left. Now you can switch your feet, these together. Let's take a look at the right. So we'll have him do 3 turns and bring it back, a couple more. It looks about the same. He's getting well past 45 degrees, right? So if you have 45 degrees or less, fail the test. If you have more than 45, you pass the test, right? So listen, younger golfers, junior golfers typically aren't going to have a hard time with that test, but I'd say once we're getting to about 40 and up, a lot of golfers will fail that test, which would indicate a lack of T-spine and trunk mobility, which obviously is going to affect their ability to turn their shoulders in the backswing and the through swing.
Yeah, and I think it's a good point that the younger golfer, I have a lot of golfers, and I'm sure everybody has these golfers, are Gumby golfers. So if anybody's, remember the cartoon Gumby, he could contort and do anything he wanted to. I have a lot of students that are Gumby golfers. They have such good mobility, but they're lacking the strength and, say, the stability in their golf swing, where sometimes the older golfer has some great strength to them, obviously through age and stuff, call it old man strength, whatever you want to call it. They have the strength, but when it comes to mobility, that's where, you start seeing that kind of fault in their body and how they really move.
Yeah, exactly. If you work with junior golfers that have great flexibility, it's safe to assume they need to get stronger. I don't think I've seen one golfer under the age of 16 that's strong enough to generate the speed and the distance and the type of swing that they want.
Yeah.
So you have to consider demographic and the type of golfer that you're working with. But again, most middle-aged older golfers will fail both of these tests, right? So you want to help them out with their mobility, or at least refer them to somebody who can.
Yeah. Hey guys, we had a question come in. If you want to go ahead and unmute yourself.
Yeah, more of a comment actually, Jason and Nick. I've been doing this stuff for a long time too, and I think the nomenclature is important. And I use these screens, but I don't like to use the words pass and fail. I'd rather use the words that's easy for you to do, and that's hard for you to do, because pass fail makes the student feel incapable or less able than when you say you failed something, that's not a good feeling. So when you point out that, oh yeah, no, look at that, it's easy for you to do that. Oh, look at that side, it's hard for you to do that. Let's work on what's hard for you to do to make you, help you improve your golf swing. Just a silly, simple point, but I think it makes a difference when you're dealing with your clients and when you're dealing with the general public too. When you're presenting.
Yeah, absolutely. So in a clinical setting, of course, we're kind of more medical fitness aside. In a clinical setting amongst our staff and when we're writing summaries and things like that, we're going to put the nomenclature as pass and fail. Now, when I have somebody in my exam room for an evaluation, I'm not telling them all the things they failed, right? But something like that, you see how difficult that was going to the right? How would that affect your swing? How do you think that's going to affect your swing? How do you feel that happen? So, you're really good to the left. Of course, we're always focusing on positives and opportunities for improvement, but I totally agree with you there.
Yeah, totally agree. And same thing in my screens. I honestly don't even tell them if they pass or fail or do anything. I'm just like, oh, okay, next screen. Yep. And then it's like, but the good thing is that they start being more aware of why they couldn't do certain things. Maybe they were trying to use a training aid, or I had a guy that, he had very poor, say, shoulder mobility, and he tried to use the ball between the arms. I'm like, you can't do that. And he's like, I wonder why I couldn't do that for the last 10 years. I'm like, yeah, because you got shoulder problems. So when we do these, there's no pass fail, but in these settings, because you guys are going to be dealing with this, so you need to know in your head kind of like what is a quote pass and a fail. Obviously, you want to try to quantify, you might have, say, a decent amount of rotation of thoracic, but based on how much you can do, the quality of the movement, we might like it, but maybe the quantity, we need that to change a little bit. But that's a great point for everybody else. When you do screens, you're not saying pass and fail, you're saying, oh, did you notice that?
Yeah, exactly. Yeah, you're right. Nobody wants to know how much they suck, right?
Exactly.
So you kind of focus on the positives, right? And just point out, did that feel a little bit difficult? Was it easier that way? But we totally agree with you. All right, let's move on to ground forces.
Yeah, so kinetics, so ground reaction forces. So this is something that, I really feel strongly about when it comes to how that helps the rest of the golf swing. So if I was in a perfect setting and I had to, analyze somebody, I would see how they physically move first. And in a perfect world, the second thing I would do is get them on some force plates if I can, because you can't see the force. You need something to measure and quantify everything. So I would say, how are they working based on, say, a couple screens that I even do? So I do a couple screens to see maybe what side is more dominant, what type of force they're allocating. So if you ever watch any videos on Swing Catalyst and do post testings, a couple testings I would do before I even have them hit a ball. You don't need a force plate for this. Post test. You're going to drop your left foot back, put your right foot forward, and I'm going to have them swing as hard as they can, and I'm looking at club head speed, okay? You can, push off, you can move, you don't have to stay on that foot. Second one I'm going to do, feet close together. I'm going to see how fast they swing. And then again, I'm going to drop the trail foot and leave the lead foot there. And I'm going to make some golf swings. And really what I'm doing is understanding, are they a rear post golfer? Do they load more into the right side? We'll call it a JB Holmes type golfer. Are they more a kind of like rotary golfer? Well, you say Matt Wolff, he's very torque oriented. And then you have kind of like a lead post golfer, if you're thinking a little bit more like stack and tilt, you know, using a lot of vertical forces. So I'm getting an idea also of how they move. But here's the problem. Your feet are on the ground and your feet are going to directly affect the knees. The knees are going to affect the hips and so on and so forth. So what I'm trying to do is I'm trying to understand, do I see any ankle mobility problems to start? Let's just say, like, we'll use a John Rahm as a great example because he's one of the best golfers in the world. And many of you do know, but he was born with a club foot, which means they had to continuously break his ankle to make sure that it was set. But he has zero dorsiflexion. So through Dave Phillips and his coach, they understood that he's not able to load this, say, joint here, his ankle joint. So they're doing different things to load. So you can use workarounds to understand. So I'm kind of looking at, say, flexion points. Do they have limited dorsiflexion, inversion, eversion? Do they have limited, say, flex in the knees? Maybe they had a knee injury. So kind of loading up into the hip could be an option for them because we're trying to find a, say, flexion point. But when it comes to ground reaction forces, I have a golfer that has a hard time kind of reflexing the knees, and he can't reflex the knees because he failed, say, the overhead deep squat test, and his ankles, he has zero dorsiflexion. So I have to work around that and understand that I got to find a way for him to use his legs differently. But also, when we see a golfer that's not strong enough, and Jason will go over screen that we can see maybe they're not strong or stable enough in that muscle group, that's going to affect the kinetics, which means that could directly affect the kinematics, which we'll talk about in a second.
Yeah, exactly. So when you see issues like this, we'll want to screen the ankles and then also test some balance. So for ankle screening, mobility is what we're looking at. We're going to look at something called eversion and inversion, right? So normally I get a head and face on, take a look at the ankles.
Yeah, there you go.
All right, and pretty much, yeah, that's to go straight ahead there. Pretty much what we want to try to have golfers roll their ankles in, out, right? And we're just wanting to see here how much range of motion they have relative to each foot in roll in and out. Obviously, that eversion, right, when the ankles roll in, is really important if they're going to load the right side, to maintain good ground pressure, ground force, and get good push off. So you see a limitation there. All right, it's just going to give you clues about what's happening in their golf swing. Now, the next one we want to look at is called ankle dorsiflexion.
So this is if you're looking at like your screens and you do the overhead deep squat test and they fail that, then we're looking at, okay, why are they failing that? We're going to look at the ankles too.
Yeah, exactly. So why don't you face 90 degrees away from the camera?
But I can see, yeah, okay, yeah.
So what you do, any golf club, take your fist, put it in front of their toes, set the golf club down, right in front of the thumb. All right, and what we want to see here is without the heel coming off the ground, you get 3 tries. All right, we're trying to get the golfer to get their knee to the club. Okay, now what you'll see a lot is compensation if they lack ankle mobility is the heel come up or the knee really dive in, actually. Yeah, so you'll see the knee collapse, right? So we want to see, do they have good ankle inversion, eversion? Do they have good ankle dorsiflexion? And if there's problems at the ankle, generating ground force, being balanced in the swing, having good weight transfer is going to be really, really difficult for the golfer. Now, the final component here that we're going to go over for this category is single leg balance.
Hey guys, I'm sorry. I don't know if your phone
Did it flip?
you're upside down. There you go.
See here.
Yeah, I think someone called you when it flipped your phone.
Okay. Sorry, guys. Give me 1 second. Is that better?
There you go.
There it is.
Yeah, when someone called your, I saw that thing flip.
Oh, geez. Sorry, guys.
So that's called the Spider-Man screen. You get on a wall, you kind of see if they can float up it.
Yeah, there you go. Yeah, float upside down. All right. Anyway, back to balance, right? So another really important for ground force, weight transfer, and just overall stability in the swing. All right. First, especially if you work with any golfer, it doesn't have to be an older golfer. Can they stand on one leg? All right. So hands facing forward, we call that anatomical position. Knees up. Now, if somebody is wobbling around and just can't hold that stance, I'm not going to the next part, right? However, if they look solid in this position, let's go back to single leg. Have them close your eyes for a couple seconds. Open your eyes. All right. See if they can remain stable. Now close your eyes. And I'm seeing how long they can hold here. Again, in the clinical sense, pass fail, 15 seconds or more would be passing. Nick is really good at this. This is extremely difficult, and you can open up your eyes. So I haven't come across any golfer who we haven't trained for a long period of time to pass that test. You're going to struggle. More or less, this isn't about passing and failing. It's how stable are they on one leg? Do they have proprioception, right? So do they have awareness of where their weight is on their foot and distributed throughout their lower body? Really important proprioception if you want to have a golfer create good ground force, all right, transfer weight really well. And if that's off, you have to bring an awareness to their feet or find someone who can bring awareness to their feet to help them stay grounded through the swing.
And let's just say, you can jump many different ways, whether it be good or bad. So let's just say someone has very poor dorsiflexion on the left leg. Now, when you jump, you're flexing in a lot of different parts of your body, and your feet are going to be one of them. So if you can't physically jump, then you're going to be doing a lot of these things. So maybe vertical forces, they're looking at that dorsiflexion, they're able to flex on the lead leg is very important. Now, again, people can still push up off the ground without, say, flexing. But if you're trying to jump on your heels and your legs are pretty straight because you can't bend anywhere, when we look at vertical forces being one of the huge components for club head speed and distance, you kind of see how these things just start interconnecting to each other. They can't do this, so maybe they're going to find a way to jump, and they can't do that, so they might just start pushing up and in because they actually can't flex at those certain spots. So you really start painting a picture of who that golfer is and explaining to them, like, it might not, you want to jump, but you just can't do it.
Yeah, exactly. Yeah, you don't want to throw swing fits at a physical problem, right? So if you're trying to get somebody, let's say, to create vertical force, but their ankle mobility is really bad or needs work, that's the place where you have to start.
Yeah, and I think it's very frustrating, not only for the coach, because we've all given a lot of bad golf lessons before. I'll be the first one to say I've given way too many bad golf lessons, but you start learning from those things. And I think the biggest frustration on anybody's part is when a coach is trying to teach something to a student they can't physically do. And then it's just like, it just kind of gets really bad from there. And you're not really doing a great job of teaching the person, and you just start teaching golf, and that's really it.
Exactly. Yeah, exactly. Okay, we got one last category here for kinematics for sequencing.
Yeah, so kinematics is simply pretty much the order in which your body's moving. So typically in the golf swing, and I use K motion because I like using 3D, and I get a good idea of if I see one of those obvious or complex or chaotic golfers, do they just look really funky, but they're doing stuff really well? Because I try not to be biased in my looks. I try not to be biased in my teaching. I'm trying to make sure that I can get this golfer to control their hula hoop a lot better. And I teach the law of the hula hoop, which is just your golf swing. So typically in the golf swing, right, we'll take aside the ground reaction force and the kinetics for a sec. But typically in the golf swing, you see the pelvis rotate first. So the peak speed of the pelvis is going first. The thorax is second, the lead arm is third, and the club and or the hands is first. Some systems do the club or the hand or both. But typically what we like to see is, lower body, upper body, lead arm, and then hand. Now, a lot of golfers can't actually disassociate your lower body. So when it comes to looking at K-vets that I'm seeing, well, can this golfer eccentrically load and concentrically load better or good or bad? I'm kind of looking at these graphs and seeing if they can do it. Sometimes it's just technique. Like, you need good coaching. You need someone to teach them how do they rotate and when do they rotate and how much. But you have these oblique abdominals that grow across your body. Okay. Now, essentially, it's kind of like this, where I'm grabbing my arm here and it's going from this point to this point. So let's just say if I can't disassociate well, I might have a hard time stabilizing the other part of the body, which means then that's going to go to the other parts of the body, and it's going to be very difficult. So we're not creating I know we say X factor stretch. I'm not saying that muscles are stretchy, but they have elastic properties to them. And what I mean by that is that once this lower body accelerates and stabilizes, the other piece is going to go because the oblique abdominals are pulling them back around. And then once this stabilizes, this is speeding up and slowing down, and this is speeding up and slowing down. So Jason's going to show us some screens of, well, are you going to be the golfer that's the Unabomb golfer, I call it, where your older golfer can't disassociate. So I call it, turning back and turning through without disassociation. I'm looking at one plane swings. I'm looking at these workarounds that really can help me out. But it's good to identify this because this is a huge speed asset that we could use on top of the kinetics, and how can I create speed and stability. And accelerating is really important, but I think what's more important, depending who you talk to, but especially what a lot of long drivers do, is how they slow down and get that grip to stop and fire that club through. And it starts with kind of this and this here.
Yeah, exactly. So when looking at this, which is sequencing kinematics, we're going to do the pelvic rotation and torso rotation test, which simply look at the ability of a golfer to disassociate lower and upper body. So we're going to get a golfer, Nick, I want you to get him 5 iron posture. Yeah. And then first thing we'll start with is pelvic rotation. So Nick, keep your upper body stable, rotate your pelvis right and left. This is another one similar to balance. You're not going to have many people do this well. However, it's what happened next, which is going to give us signs of what that golfer needs to work on in the gym or at home to get better at dissociating. So Nick, show them the most common flaw, right? Turn the hips, shoulders go all over the place. You're going to see a lot of side-to-side motion.
Or the Jason Duffner.
I'm just not able to move. So if you see that, they can't disassociate, hold on to their shoulders, right? And if you see an improvement, right, well, now we know it's a stability issue and a motor control issue, right? Now, if we're holding on the shoulders and they're real still rigid, like everything's still turning, regardless of how old you're on, then they have a mobility issue, right? So that's disassociation of lower body pelvic rotation. And you want to take a look at the upper body too. So let's do torso rotation test. Same thing, same setup. We're going to do little shoulder turns. This isn't quantitative, just qualitative. I'm looking at, is he stable in his pelvis and legs while the shoulders rotate? He is. Now, if they couldn't disassociate, you're holding on to the hips, you got to keep turning to stabilize. Now, if that gets better, they need more stability in their core and the lower body. If it doesn't get better, if everything's still jammed and rigid, it means they need more mobility through the spine, right? So that is a really strong test, right? For any golfer, you'll probably have it a part of your assessment as it is, because if they don't disassociate well, they're going to have efficiency issues in the swing. And to me, we use the term low-hanging fruit a lot, but especially when it comes to older golfers, senior golfers, all right, we want to make sure that we can improve the quality of their functional movement and these movement patterns if their goal is to create more speed and power. Because efficiency is the key word. When a golfer can disassociate the lower and upper body, they're going to be more efficient in this kinematics, right? And that's easy to do, right? We can get any golfer of any age doing these movements patterns better, right? And it doesn't require all the effort, and the downsides, the risk of power training and heavy weightlifting and things like that.
And I'll just compliment that for one comment. You can have really good golfers that don't pass these tests. So when I went to level 3 in California, there's only, based on, and you can see all those videos they post and all the screens that they do, out of their entire database of golfers, only 2 golfers passed every screen perfectly. One of them was Adam Scott. And if you know Adam Scott, he's like mid-40s and still hits 185 ball speed. And the other one was a female golfer. I believe she's a professional. Forgive me, I can't remember her name. But it doesn't mean that you're not going to be good at golf. But we're looking for more efficiency. How can someone be even the better version of themselves? So like I use Jason Duffner. He won a major. And he can't, if you look at a video, he looks like this when he's trying to disassociate his lower and upper body. He can't physically do it. But when you start seeing these things and how they move and how their golf swing is designed, you can really help your student out, because I'll be very honest, depending who you talk to, there's going to be some group of people that are going to say, I'm not doing any stretches. I don't care. Get me better. And your job is like, oh God, well, I got to figure out a way to get this person better. So that's why understanding workarounds, even if the golfer is not going to do anything, can really help you out. And I know everybody has those golfers at their facilities. There's a good majority of people that are going to be like, yeah, they'll do literally anything for golf, like anything. They'll get better. They'll stretch. They do what they got to do. That's why I refer a lot of my students to Jason, because we can talk and stuff, but it doesn't mean that they're not going to play well, but they can play better if they're able to move the way they want and control those motor patterns.
Yeah, that's a great point. We're not showing you all this to say that it's responsible for you to now fix these issues. All right, we're going to do a future webinar, hopefully next month, to spend a little bit more time looking on corrective exercises for these things that you can give your students. But more importantly, we're just giving you a tool here for assessment. So you can take these assessments, these results in these screens and help the golfer build a swing around their limitations or for their strengths, right? All right, Matt, how are we doing on time? Should we wrap up?
Yeah, I mean, if people want to stick around and ask a few more questions, they're more than welcome to. You know, typically we can go an hour, so if you guys have more to present on, go for it.
Yeah, absolutely. Okay, I thought we were maybe doing a half hour. So let's go through some correctives now. So when I say correctives, basic exercises, mobility drills to help your student on the fly make a quick change. Now, these changes probably aren't going to be permanent. Like when we evaluate a golfer, we're with them for 2 hours, right? So we're doing these movement screens as kind of the higher level stuff, the tip of the iceberg, so to speak. But behind every issue with a motor pattern or with functional movement, especially as golfers get older, we're going to see some orthopedic issues behind it, some of those root cause issues, right? So these exercises are a really good quick fix. You're going to get more mobility instantly, which of course is going to help you within that lesson. If you need somebody to turn better to the right and you can help them physically gain 10 degrees of range of motion on the spot, that gives them a better chance of getting a good outcome in that lesson and getting the feel of what you're trying to get them to do in the swing. Now, if they remain locked up and you're trying to get them to do something that they can't do physically, that can get a little frustrating. Best case. Worst case, you have somebody do something repetitively that they can't do, maybe not within a lesson, but within a month of practice routines. Worst case, they can hurt themselves or at least feel pretty banged up, right? So what I would venture to say is if we're talking, let's say 40 and up, the tests that 80 to 90% of your golfers will fail are the lower quarter rotation test. So that was the one with the golf club on the floor, and seated trunk rotation test, right? Probably balanced too. So let's go through a couple of exercises, things that you can do on the spot to get quick changes. So with hip mobility, the lower quarter rotation test, the few things that we like to do, I'm going to give you 2 exercises. First one's going to be hip windshield wipers. So I'm going to get Nick on the floor here.
I'll go.
Yeah, space that way. Right. So let's go in a seated position, Nick.
Oh, wait.
Yeah, facing the camera.
Oh, that's right.
Yeah.
Yeah.
Let's go in a V-sit. There's something a little different. Yeah.
This way?
Yeah, Nick. So we're going to have the legs straight. Nick's been at this.
Oh, windshield wipers. Oh, my bad.
Yeah, he's been doing it for a while. He's doing some pretty advanced stuff. All right. So we have seated, hands behind your hips. And first thing here is we want the golfer in really straight, tall posture. Most golfers will be able to get in this position. Now you see the V-sit position with the legs stretched out. We don't want to be them so far apart where they feel limited through the groin. So get them to the point of stretch where they feel a little stretch and then bring them in a little bit from there. Okay. Now let's say your golfer cannot turn into his or her right hip. All right. What we want to do is try to unlock that hip with a coiling motion of internal and external rotation. So I'm going to have Nick do first is distract this hip, which essentially is decompressing the hip. So Nick, you're going to push your heel away from the hip. And the leg goes out maybe an inch, not far, but that's enough to get some decompression of the joint. Now, keeping that length of your leg, keeping the heel away from the hip, you're going to turn your thigh, that's key, the thigh inward and outward. A nice pace. Doesn't have to be really fast, but also not so slow. And this is one that we've done a lot, especially for Nick's right hip. You can see here, what I'm really interested in is how far does his foot turn in? Now, the first set with this is going to be like 2 sets of 10 each side. Most people are going to struggle with that internal rotation. Let's show them some reps on the left. So he distracts the hip, all right, turn in, turn out, right, the 10 reps.
And when he means distract the hip, I'm essentially trying to feel like I'm unscrewing my hip joint from like my pelvis. That's kind of pushing it out and twisting it, kind of trying to unscrew it. So if you want to use an external cue, just say you're trying to unscrew your hip joint, essentially.
Yeah, exactly, right? And let's go back to the right. What you guys will see if you were paying attention to his right foot is in the second set, he's going to have a lot more internal rotation, be able to turn that leg in a lot more. Once you start to see that, say, okay, good job. We're going to retest. And I guarantee you're going to see much better trail hip or right hip if they're a right-handed golfer, internal rotation, which is immediately going to improve their ability to load the hip and turn better in the backswing.
Now, just for a workaround, because I'm going to try to add this in, if say someone has a really hard time and maybe you're not comfortable with adding this into you, you can have some workarounds. So a couple little things you can actually do. Flare the right foot. So when you're flaring the right foot, you're giving more range of motion to be able to internally turn it to the hip. But when your foot is, say, straight and someone can't do it, then you're going to see a lot of these issues. Another thing you can do to help them give a little bit more range of motion is that you can actually have them drop the right foot back as well. That gives them room to, say, get the path more in the out and the downswing, because I'm essentially shifting my swing circle to the right by doing that. If you have someone, and this was part of working my golf swing, my right foot was forward. I did have some foot flare, but when I try to turn it to the hip, I get discomfort, and then I'd start, because I didn't want to hurt myself, I started going like this a lot and standing up in posture, having a flat kind of shoulder turn. So that's kind of some workarounds you can kind of do to just help your golfer improve just the backswing.
Yeah, exactly. And let's show you one more. You might have some people, or maybe you're outside or it's a little wet, you don't want to get them on the ground. Grab a longer golf club, such as a driver, or you can even grab onto a tree, a golf cart, something like that, and have them do an exercise called store turns, right? So let's go to the right here. So let's say we're working on a right hip issues with the backswing. We get him on a post position. He's going to hook his left foot around the right knee, and then keeping the upper body as stable as possible. You can bring it back. All right, he's going to rotate his pelvis to the right and to the left while trying to keep the shoulder stable. So we actually get a 2-for-1 here. If you see a golfer that struggles creating disassociation, this is a great way to train that. A lot of people have really good results with this one. And we're also working on mobility of the right hip here. You could do it on the left side too. If they're having some pelvic or lower body rotations in the downswing, right? It was a good one to help improve the mobility of the left hip. Balance, right? So you're getting a lot of bang for your buck with this exercise. What I'll say is most people won't be able to do it with a unstable support initially, such as a golf club or a bar. So just get on something a little bit more stable, and at the very least, get them used to internal and external rotation of whichever hip you need to improve, right? So we had the hip windshield wipers. We just showed you the store turns. Two great options if you find that a golfer has limited hip mobility. Even if you don't screen, if it looks that way, you can give these two a try to see if we can get them rotating the lower quarter, the hips, get them lowering a little bit better. Right? Okay, so that's one very, very common issue you'll find with the golfers is hip mobility. The next one, particularly with older golfers that we're going to find, is trunk range of motion or thoracic rotation. So I would say the quick fix for this is probably a little bit simpler than what you just saw, but I'm going to have Nick go and take a seat here. All right. And let's say you had a golfer that couldn't turn their trunk or their shoulders well to the left, right? You see that in the lesson, or you see that with the screen. This one's really simple. Let's actually get the feet spread apart as wide as you can, all right? So having the feet apart kind of locks in the lower body. So also we're creating a little bit of disassociation here between upper and lower. Now, if he struggles going on the right, I'm going to have him take his right hand, place behind the small of your back, left hand on your chest. Okay. Now, from here, I'm going to have Nick turn as far to the right as you can, head, chest. Now, hold that. Here's what's key. Take a deep breath in, big exhale, and go a little further. Okay. Without that big breath, you can bring it back, Nick. Without that big breath, you're not going to get much out of this. Posture, really important, right? How many golfers do you instruct with really bad posture? Now, in a seated position, it should be easy for most people to get themselves in a good posture. So that's another thing that you really want to cue if you're going to use this exercise before or during a lesson, is to get that golfer in a nice, tall, chest up posture. So let's do one more rep. All right. Big turn to the right. He holds it, takes that deep breath in. Big exhale. Get a little bit more rotation. I think if you have your golfer do that about 5 times, the limited side or both sides, you'll get immediate outcome in getting their upper body or their trunk to rotate better to whichever side you want to see that rotate to. Okay. So that's trunk rotation. Now, let's get you back up.
And just so there's somebody, more and more I dive deep into like fitness and how that works into golf swings and stuff. You'd be surprised how good diaphragmatic breathing exercises are for mobility with, obliques, with torso, through all these things. It is so good. And every seminar that I keep going to, they talk about how you breathe, and how that can actually really just get you more thoracic mobility just by how you breathe and where you load your breath. And I think that's something that, I really didn't think about. It's like I wasn't ever the meditator, call it, or whatever it is, but breathing while you work out or stretch it's really done wonders for me, because there's certain parts of my body that I just couldn't move. But then the more that I did it, I'm like, wow, I can really feel the stretch just by adding the breathing with what I'm doing at the same time.
I'll take it a step further. If we have somebody with mobility issues, regardless of who they are, we're going to start working on breathing patterns.
Yeah.
Ribcage breathing, diaphragmatic breathing. And I'll see after getting the diaphragm working to help expand the ribcage, we'll get 10 to 15 more degrees of rotation without doing anything rotational, without any rotational stretching or strength or motor control work. So breathing is really powerful. If you're having a golfer do an exercise or doing a stretch, really highlight the importance of deep breaths through the belly, through the ribcage. Right. Okay, let's go through just a couple more correctives. And I think these exercises, you get a lot of bang for your buck too. You're going to get stability. Of course, you're going to get balance, proprioception. Let's do some single leg balance work. So,
hey guys, before you jump into that, we had a question come in, if you don't mind.
Yeah, go ahead.
Go ahead, Bill.
Yes, good morning, gentlemen. Can you hear me okay?
Yes, sir.
So what you're saying is that, and what I tell my students is that I like them to exhale before they swing because it relaxes their muscles. Is that something you would agree with?
Yeah, definitely. With that exhale, all right, we're going to get a short relaxation of connective tissue, of muscle tissue. So I think, if that's a thought you want to give to your students, that's the right way to put it. Deep breath in, exhale, maybe pause a second and have them swing. Yeah. Have you ever done anything like that?
Not necessarily. I know people have done that to mess with people. Do you breathe in or breathe out when you hit the golf ball? I know that's always like a fun little thing on the tee to mess with your students on. But I haven't personally done that. But the one thing that I have explored in the past is actually using that breath as a trigger before they hit a golf ball. So some people have kinetic trigger. Some people have, we'll say Brent Snedeker has a figure trigger with his hand before he goes back. I've had people say, all right, well, I'm going to go and then time that breath maybe with the swing. I don't really explore it too much, but if you can find something that helps somebody, I say, why not do it?
Yeah, exactly. As long as it's helping, it's not distracting. Yeah, go for it.
Yeah, absolutely.
That's exactly what I was trying to get to, that use it as a trigger and also as a relaxation technique.
Yeah, and everybody has their own trigger. I've seen anywhere from a Snedeker trigger to a Henrik Stenson trigger to a Jordan Speed trigger with feet and stuff. And you have other triggers too. So yeah, you can use anything you need to help your student out, kind of get them going.
Yep, absolutely. Cool.
Thank you.
Great. Okay. So last one, you're going to find a lot of students with bad balance. It's going to affect their footwork, their weight shift, and their overall postural stability in the swing. So actually, now these next couple drills are something that I've seen Nick use with his students before. I think we get really good results here. So let's do some single leg address. Why don't you face that way? And let's go feet together. Let's get mid-iron posture. All right, arms crossed around the shoulders. And let's get in a kickstand position. You're going to have your left foot back on the ground, Nick. Flip with the left foot back a little further. So when starting this, let's just get 99% of the weight in your golfers. In this case, the trial leg, we could do lead leg too. Now, so there's hardly any weight in the back leg. And the first thing I'm going to have a golfer deal with this is just start rotating the trunk to the right. And what I'm looking at most times is the foot. Is the golfer rolling to the outside of the foot? Are they doing a good job staying grounded? So what we'll see a lot is turn here. You'll see the knee bow out. You're going to see the ankle roll out. So we're cueing, feel the foot. Be stable at your foot. Press the weight into the inside of the foot, just to give them that feel of the engagement of your legs, the adductors, the glutes, get the foot working a little bit more. Now, from here, if they do okay with that, let's go back to kickstand. What I'm going to do is I'm going to have that golfer lift their back foot off the ground, right? Hold 15 seconds. Can a golfer remain stable here? If not, that's where you stop. You have them work on that. Now, if it looks good, as it does with Nick, then we're going to have them in this position, rotate the trunk to the right, and we're back to the foot and the knee. Are we stable? Is the foot being everted, rather? So is the inside of the foot remaining down on the ground? Do they look balanced, right? And doing this is great feedback right away, great field training to get a golfer to load the inside of the foot better in the swing, to get them to load their hip better in the swing, and just kind of wake up the proprioceptive system.
And even right there, I felt my glutes just turn on instantly. And that's good sign, because if we are seeing hamstring and different other parts of your body really try to pick up the slack, we understand that it's probably a glute deficiency. And if the glutes are off, you know, we got to look at, are they having, say, lower cross syndrome, where the abdominals and the glutes are not working, so you're going to get a lot of hamstring working. So there's some screens that we do for that. But, you know, you're getting an idea of like, what are they using? If they feel like, oh, I'm using this, then like, all right, we're going to build that intrinsic feel and just say, okay, well, I want you to feel this. And then they can describe to you how they feel. It might not be right or wrong, or it might be indifferent to how you view it. But as long as you're seeing them doing the right thing from a motor pattern standpoint, motor control standpoint, we're like, okay, we got it going here. And then we can do some kind of progressives. And that's why, you know, Dunnigan always talks about the progression of greatness. We started out with foot back, foot up with rotation. And then we're going to add some maybe dynamic drills. Maybe it's some lateral bounds, kind of seeing how they change direction. That's the kinetics part of it. And the tilt's all kind of within one little bucket there.
Yeah, yeah. And that, especially that exercise, it's just a framework for you guys. If you guys have Golf Forever at your facility, some resistance bands, right? We can have them do some presses, right? Out with resistance. I know Nick uses that a lot.
Big fan of Golf Forever. I use it with Anthony Sebastianelli when it comes to how we load the backswing. And he loved it so much that he bought it himself. And it's great because it's on your range. You can do a bunch of exercises. It has different kind of components to how you interchange it too. Not the shameless plug for him, but I just really do enjoy using that. And Joanna and I use it on the lesson tee almost every single day.
Yeah, it's a great tool. And you can get somebody kind of away or out of their mind without the golf club, get them to feel, get them to own positions with drills like this. You add tools like Golf Forever, or even just simple resistance band into the mix. I think you can get some really good outcomes very, very quickly. So in future webinars, we're going to be doing a webinar once a month for this year, I believe. I think in our next one, we'll go over more corrective type exercises, or we can even call them drills that you can give the students within a lesson to address any type of mobility, balance, or stability issue. But there's a nice little taste. If I could just pick a couple of things to give a golfer to work on to get good outcomes and results quickly, we're going to work on improving mobility. We're going to work on improving balance. Right? 90% of golfers are going to get really good results with just that work alone. We're not talking about strength training yet or power training. We're not throwing medicine balls. So a lot of the stuff that you see on Instagram in terms of golf fitness that looks really cool, and I agree it is really cool, probably isn't the right thing to suggest a golfer to do. And of course, I get people come in here all the time, show me videos. Can we do this? Most times I'm saying, not yet, because we have to be able to stand on one leg well. Your mobility, your hip needs to be better. The glute needs to be stronger. Once we do those things, all right, then we can work on some of that, the look and stuff. But like I said, these are just some great, really easy options to give your golfers on the fly within the lesson itself to help them get a really quick change, to help you out, get better outcomes within that lesson.
Yeah, and going through a lot of the stuff with other trainers and Jason, because I've been working with Jason for a little bit now, and I've really enjoyed what we're doing because we communicate a lot with the golf swing, and we also use the same kind of type of technology for assessments, but also that progression. So if you've ever done workouts, I call them the workouts that impress the ladies, you know, the curls, the bench, and all these things. They can be difficult, but it's one plane of motion. Once you start adding other planes of motion, because we work in 3 planes, you know, frontal, sagittal, and transverse. So I'm bending, side bending, and rotating constantly in the golf swing. You'd be shocked how difficult simple golf corrected exercises actually can be. So from a golf standpoint and a coach standpoint, I use a lot of these in the lesson tee, but they're very basic, but they're just not easy. So when you start adding weight, and I know for a lot of junior students, the last thing we do is add weight. It's a lot of body weight stuff because they can't even control their own body to that point. So we have to understand, if we're trying to put something on a body that can't hold it or can't support it, and we do some sexy exercise that is cool because we saw, you know, Joey D performance, and I love all these guys' stuff. I think it's really good. But the exercises you see like these guys like Fleetwood and Scheffler do, and all these guys, man, they are so difficult. And every time Jason adds a progression for me, because I feel like I've kind of gotten a pretty good kind of trend here, I'm like, damn, that is tough. But it's so simple, but it's just very difficult from not only a muscle standpoint, a motor control standpoint, but then adding those pieces with rotation and different planes of motion. It's just not easy. So I will say less is more from the lesson tee to start, because again, you're starting somebody that can't even do this, and then you want to add a medicine ball and throw it really hard. You're in for a rude awakening pretty quick.
Yeah, exactly. Very, very well put. And that goes for yourself too, guys. You know, if you're looking for solutions for your own body and for your own golf, you want to start small. Actually, one of the things that we offer for you guys is a free 2-hour evaluation where we can assess you. It's twofold. You can learn about yourself, your body, your swing, but you can also learn these deeper assessment skills for your students that give you some extra tools at the lesson tee. And you guys do get two, it used to be called MSR credits. I know they changed the name. You get 2 continuing education credits for doing that evaluation. So if anybody's interested in that and wants to learn more for yourself or for your students, I put my email and cell phone number in the chat. Make sure that you take that down and just shoot me a message if that's something you're interested in.
Yeah, and from like me learning, because I'm constantly wanting to learn. I call myself kind of like a thinker. I'm just trying to figure out things as best I can. I've learned so much just by working out in the gym all throughout these years, because I did, wrestling type exercises. I did other sports to help for that sport. But then the more that I'm working with Jason, we talk, I'm really understanding the golf swing through a different lens. And it's really cool to kind of see it from his end, because then when we talk about our students, and when I talk to other trainers, I can kind of speak their language, and it's really nice because we're like, oh, I know exactly why you're working on that. And I'll even come into Jason and be like, I know why you're doing this today. And he starts smiling. He's like, oh, you know why? And we start having a conversation while he's torturing me in the gym.
Yeah,
Yeah.
exactly. All right. Any questions, guys?
Go for it, Bill.
Okay, so this is Bill again. Can you hear me okay?
Yeah, Bill.
So I'm going to go all the way over here to the chat with everyone, and that's where I'm going to locate your email address.
Yeah. So, Matt, if you want to direct him on that.
Yeah, Bill. If you see the chat at the bottom right-hand corner of your screen, it looks like a little thought bubble. You can click on that, and the email should be in there. And if you don't see them, let me know, and I'll email them to you.
Okay, I got it. Thank you. Appreciate it.
Thanks, Bill.
Thanks, guys.
You're welcome.
Any other questions?
Go for it, Roger.
Yeah, anything in the gym that you see your students do that actually is not good for the, I see some guys come in, they're big squatters. They do a lot of squats and, like you said, the ones that impress the women, but then it's tough on their hips. Is there anything that you say, well, man, this is really crushing in the golf swing?
In all honesty, no. It's so, you got to take it by an individual basis. There's some people that should be doing back squats, heavy squats. There's a lot of people that shouldn't be doing it. There should be people that are doing heavy deadlifts or people that shouldn't be. I mean, it's all relative. I think as long as it's not doing harm orthopedically, it should be okay. I think the problem is most people are working on the wrong things, right?
Oh, yeah.
So if you have kind of a muscle bound golfer that likes to squat, that's fine. But if you're spending all this time with weightlifting and things like that, but not spending any time on his mobility, obviously, then that's an issue, right? So I think it's key to have a plan as a golfer, whatever competitiveness you are in, to work on your weaknesses, to work on things that are really going to help improve efficiency and motion in the swing. But I have a tough time saying that there's exercises or a particular thing that we don't want people doing. Of course, injury history, that's a different story. If somebody has a knee replacement, do we want to have them do it heavy bilateral squats? Probably not. So that's one thing, but there's really not one thing that I can point to say, oh, I do not want golfers doing that exercise or that type of workout. I think if they're doing something, that's a positive. But like I said, most times just golfers aren't working on what they should based off their body and their movement patterns.
I actually got one that I thought of talking to Jason Glass, TPI, fitness professional over at the TPI facility. He made a good point about pull-ups a lot. So shoulder mobility is important, upper body strength, all that kind of stuff's important. So a lot of what people will do because they can't actually do a pull-up, and I've seen this before, and I just seen it a lot, is that you'll have people actually start and then let themselves fall down. And they're like, oh, because I can go down, that means I start building the strength to go up. But unfortunately, you start hurting yourself because number one, you might have really poor lats. So hands above your head, that could be really difficult for you. That's probably the one that I'll never pass. I just try not to suck less at it. But I know pull-ups are a big thing, but if you don't have good shoulders and you're trying to get pull-ups and you start from the position here and start dropping yourself down with maybe no band even below you, that is one for a fact I've seen people get hurt doing. But it's all based on like moderation. They think like, all right, well, if I do maybe one or two, or if I start in a certain position and go down, like they actually start hurting themselves when they try to have good intention, but eventually it's bad intention because of what they're actually trying to do and what they can't physically do when they do that.
Yeah. And that's a great point. And we'll take Nick as the example here. There's a test, a part of these movement screens called the lat test, where essentially you get a golfer sitting against the wall with a little squat with a flat back. We're trying to get their arms or their thumbs to hit the wall above them without bending the elbows. That tells me if a golfer can get their arms overhead well, if they have good shoulder mobility. Now, for whatever reason, we've been trying to figure it out. We can't. Nick's arms and lats just do not want to do that, which is fine. So from a gym standpoint, I'm not going to have them do a bunch of pull-ups or chin-ups. Anything overhead is going to be out in this plane where we can put the arms up here, not there, right? So there's a lot of ways that we can do that. Now, from a golf swing standpoint, Nick, you can tell them about what you think about your hands and what you would do.
Yeah. Yeah. So it kind of like, you kind of find out how you tick a little bit more when you're in the gym. So I can't get my hands above my head. So when it comes to losing tilts and stuff, if I try to get my hands higher and I can't do it, I'm going to lose those tilts more. So from a one plane golf swing standpoint, and, you know, one plane just simply means in your backswing that your shoulders are, your arms and your shoulders are kind of on the same plane here. This would be two plane. This would be one plane. So for me, I work my hands a hair deeper because if when I'm here, I can stay in posture. But for me, I feel like when I get this way too much and I can't do it, guess what? If my lats don't work, something else is going to have to work here. So working the golfers a little deeper might help them because they don't have to lift the arms above their head. And also because I'm so torque driven, like I'm really good at rotating, it actually works out for me because then I can bring that club back out in front and not get so outside in. But if I did it from this standpoint and I can't get up and then I start turning, then I got loads of problems.
So I know we got a little off track there, but I think the point is when it comes to bad exercise selection is what can their body do? What can it do? And that goes for the golf swings. Their body can't do something. If the golfer can't get his arms up,
Don't do it.
don't do it in this way.
See some more questions in there.
Roger, go ahead.
Yeah, for those guys that really aren't gym people or, you know, just students that aren't gym people, yoga, you like yoga for that? If they can get them in at least yoga?
It's a little question. So if they have a healthy spine, yes, that's fine. Now, a lot of older golfers are going to have particularly lower back issues, disc herniations, spinal stenosis, a host of issues, structural issues with the spine. Yoga oftentimes promotes whether it may be a hyperextension of the spine, which may be okay for some people with back conditions, but may be horrible for people with other conditions. Sometimes to promote hyperflexion. So I think yoga is good for most people unless there are structural issues with the spine, in which case other things probably need to be addressed first before that person participates in a yoga program. So it really depends on injury history there with yoga.
Any other questions?
Yes, I'm not sure if you can hear me. My name is Corey. I'm calling in.
Gotcha, Corey.
Hey, question on the other scale of like a 17-year-old, 18-year-old, good mobility, looking for strength, going to college golf. I spoke to one college coach and he said that they are into Olympic lifts and that's the direction for strength and speed that they're looking for. Is that something you recommend?
Yeah. Now, Olympic lifts just need to be coached up really, really well. They're highly technical. So really important for that student of yours to probably listen, they'll do a great job in the strength conditioning program to get these kids up to speed on that. But if he wants to hit the ground running and build up some power and strength ahead of time, he really needs to go see a fitness coach with an Olympic weightlifting background, to make sure that he can start working on this stuff, but not put his body at risk of injury.
Yeah. And I think that's they're talking to a lot of coaches that have put golfers into D1 programs. You know, their coach is probably going to expect you to be already know how to do these things, and well, not just with a club in your hand and just getting the technique. I've heard of golfers where they went to the D1 program, they're just really good and skilled, and they didn't know how to do all this stuff, and they actually took their scholarship away because they're like, man, we got to really work on this golfer, but they want like the golfer to be already quote unquote ready, whatever that may mean. So yeah, I mean, I know I do progressions of, trap bar lifts and stuff like that because I'm really trying to work on how my pelvis moves a little bit because that's my focus for me. And people hinge differently, taller guys, shorter guys. Greg, I know you're thinking, Nick, you're the shorter guy here, obviously, but being able to be like from a coach standpoint, you got to be able to do that before they get into that program because that person might be in for a rude awakening when they get there.
Yeah, exactly.
And do you believe that the strength side, that's the fastest way to get there is through the Olympic lifts?
So Olympic lifts generally are going to be implemented within a program to build body power, right? So if we think there's power and speed kind of at the top, there's muscle strength.
Because they are different.
Yeah, they are different. Muscle strength, there's muscle size, right? And underneath that is good movement patterns, right? So if we're looking at this pyramid, this is exactly how
This is literally what we did here. Yeah.
Initially, we're building movement patterns. We're building range of motion stability, right? From there, actually, we then typically, it depends on the golfer. If someone's a little bit older, we're going to work on strength and not muscle size.
Yeah, correct.
Right. And given the time period in which Nick and I were training, so we went from mobility, motor patterns to muscle strength. We got his muscles as strong as possible. Now, we just came off a hypertrophy phase, right? Where we were actually added weight to his frame. So we were building muscle size. And then now we're back into a heavier strength phase. Once this phase is over, as we get closer to the season, we're going into a power phase. So this is long and short of saying that building muscle power or body power is not going to be the same as building muscle strength. If a golfer wants to become more powerful, but they lack muscle strength, there's no point in training for power. We have to have a good, solid engine. We have to have a big engine. So if it's a kid and he's really skinny, we're going to look first at how can we add muscle to his frame? How can we get heavier? Once we do that, how can we get those muscles as strong as possible? Once we do that, now we're talking about power. We're talking about Olympic weightlifting.
Because if you get someone say they build muscle mass and they're not able to move well, you just made it worse. So that's why strength and power and how you lift, whether it's isometrically, eccentrically, concentrically, how these muscles lengthen or shorten, or how you hold it, because there's exercises where you have high velocity but low, like say acceleration, or high acceleration and low velocity, or a lot of say power in like holding something, but you're not moving at all. So that's why with Jason, he's the expert on like how I do something. Like if I'm doing a push-up, I'm going say slow one way, I hold it, then I go fast the other way. They start working to what the golfer needs. But I love what you said, that strength and speed and power, they are kind of in the same church, but they're not in the same pew in that sense. They're very different things in how you actually train them.
Bill, did you have another question?
I just had a comment. I'm actually 75, and probably for 35 to 40 years, I've been working with that Total Gym, the Chuck Norris, Cindy Brinkley piece of equipment that's in my garage. I'm not a gym guy, but I really like to work out, and I've had a lot of success with that, and I just wanted to make that comment. Thank you.
Yeah, it's great.
Yeah, it's great. Love it.
You're already ahead of most people. You're doing something and you're consistent. I mean, that's the key. Let's just start by doing something. Let's do it consistently. If it makes you feel good and you feel like it helps, you're ahead of the game, and that's awesome. Congrats.
Any other questions? Okay, well, I really appreciate Nick and Jason for your time this morning. I thought that was excellent, and thanks for everyone for coming in with questions.
Yeah, thanks for coming, everybody. Feel free to take my email, my phone number. Nick has his email in there too. If you have any questions, you want to get assessed by us, if you have students that you feel like need his assessment, we'll give anybody a complimentary screen or assessment for students for yourself. So in any way that we can help, just let us know.
And for me, if you ever want to, I offer this to absolutely everybody, whether you might have an intern that works at your facility, yourself, or another employee, you are always welcome to come shadow my coaching. I encourage that. That's the way I learned a lot. So, and I like to incorporate TPI stuff all the time in my coaching and my teaching. So feel free to come on over and shadow me anytime you want. Just reach out and let me know.
Thank you, everybody.
Thanks, guys
guys.
and gals.
Thanks, guys.